So erectile dysfunction is the problem men develop where they can't get or keep an erection that's strong enough to have satisfactory intercourse. It's actually a very common problem, and it gets more common as men get older. Over the age of 50, probably 50% of men have trouble with their erections, and over the age of 70, it's probably 70%. It tends to be underreported in that patients tend to suffer and not necessarily seek help, and that's partly because they're embarrassed and partly because they don't really know what treatments are available to them. One of the good things that's come about in the last 15 years with some of the simpler treatments for erectile dysfunction is it's made men realise they can come and seek help. One of the other important things about erectile dysfunction, which people have come to realise in recent years, is there's a very strong association between coronary artery disease and the development of erectile problems, because it's predominantly to do with blood flow. So men now come to seek help for their erections. We really need to talk to them about the fact they could be developing coronary artery disease at the same time. I generally break up the causes of erectile dysfunction into either different parts of the body or different anatomical causes. So to have a normal erection, the brain has to be working correctly. We need to get the nerve messages down through the spinal cord to the penis. The tissues in the penis need to be normal so they can react appropriately. And most importantly, the blood vessels within the penis need to be able to open up to allow a man to get an erection. The other important area for having normal erections is the hormone status of the body. So testosterone levels can be important as well. Having said that, the most important cause of erectile problems is poor blood flow into the penis. And this is the problem that develops as men get older, and it's more common if they have risk factors such as smoking, high blood pressure, diabetes, high cholesterol, being overweight. So all the things that we know are risk factors for coronary artery disease are also risk factors for developing erectile dysfunction. Some men do develop erectile dysfunction purely because of psychological problems, but that's actually very much the minority. So whilst most men with an erection problem get some psychological effect by having the erection problems caused purely by psychological disease is much less common. So we are looking for underlying true pathological diseases. Generally, when we're talking to a man who's got erectile dysfunction, we make the diagnosis largely on the history, that is what the patient tells us. And we've obviously got questions we want to ask them about underlying illnesses, medication they're on, previous surgery, etc. But it's very much a diagnosis we make on history. We examine the patient, and often we won't find very much, but sometimes there is a condition we can detect in the penis, such as Peyronie's disease, which is a condition that causes a bend in the penis. If we are going to do investigations, we want to measure their testosterone level in their bloodstream is important. We usually take the opportunity to also do a prostate blood test, a PSA. And then the one specific investigation we have is we can measure the blood flow into the penis by using a Doppler ultrasound to measure the velocity of blood flow through the arteries in the penis. Generally, however, we don't need to go to that extent because we can often make a pretty straightforward diagnosis from the patient's history.